Okay, well, I've been told that Senator Washington is right outside here, so I'm going to count her as part of the quorum. I'm going to take the liberty. Okay, guys, thank you. And again, sorry for the 1 hour delay. We're going to start with our briefing on PFAS regulation and management in Maryland. And we're going to start, we've got two separate panels. We've got the Maryland Department of Environment panel first, and then we'll have a second panel. I've got Zachary Schaefer, Lee Curry, and Rick Kessler. Is that correct? Is that who we have here? Okay. And I have it wrong. Okay, so do you all have an order? We do have loaded up the PowerPoint, and so who is taking the lead here? Okay.
That will be me, Chair, and we'll all three be able to answer questions as the committee has them.
Okay, and you're Zachary?
Yes, sir.
Okay, Zachary, why don't you state your name for the record, and then you can proceed, and then however you guys want to organize, we'll do that, and then we'll take some questions from the, I think from the members after you've completed. Well, let me ask you this, how are you splitting? Because maybe we could take questions after each one of you does. Is there like three distinct kind of topic areas, or it's all?
It's all related.
Okay, well, why don't you guys then do your thing, and then we'll take questions after that.
Okay.
Okay, so Mr. Schaefer, why don't you start?
Excellent. Well, thank you, Chair Feldman, distinguished members of the committee. For the record, I am Zachary Schaefer, Assistant Secretary at the Maryland Department of the Environment. I joined MDE exactly 1 year ago yesterday, and prior to that, I served as Director of Policy at the U.S. EPA's Office of Water, where I worked on many issues related to public health and the environment, but in particular helped to lead EPA and federal efforts to address PFAS. That work gave me a deep appreciation for how complex PFAS issues are and how essential it is that we address them in ways that are effective, affordable, and practical for state and local governments. And I can tell you firsthand that Maryland is leading with that mindset. Should it? Oh, there it goes. So what are PFAS? PFAS, which stand for per and polyfluoroalkyl substances, that is the last time I will say that today, are a very large family of about 15,000 chemicals. They were invented in the 1940s, just across the border in Delaware, and have been used widely because they are so useful. They are the active component in many nonstick coatings, in waterproof clothing and stain-resistant carpets. Some of them are critical to life-changing and life-protecting products like firefighting foam, medical devices, semiconductor manufacturing. They resist heat, water, oil, and degradation in extreme conditions. However, that same resistance means that they don't break down in the environment, and many of them accumulate over time in our bodies. According to the CDC, nearly every American, and likely most people around the world, now have PFAS in their blood. This slide has a lot going on, which is kind of the point. PFAS are a complex problem, with many sources, many ways they get into and move through the environment. We have industrial facilities that use PFAS, and it can be released in air emissions and water discharges. It's been used for decades in specialized firefighting foam, so it can be found in high concentrations near airports, military bases, and firefighting training centers. Certain PFAS are active ingredients in dozens of pesticides that continue to be used on crops around the nation. And because they are in countless products that we throw away, it ends up leaching out of our landfills. And wastewater systems are also receiving PFAS from residential sources, from you and me. When you shower off your water-resistant sunscreen or streak-free cosmetics or launder stain-resistant shirts and waterproof jackets, it goes down the drain. And from there, they get into the soil, the air, and ultimately our rivers, streams, and groundwater. Let's talk about how you get exposed and what that means for human health. These chemicals are used so widely, and because they get into the environment and don't break down, we start to come into contact with them through a lot of different ways. You can drink it, you can eat it, you can breathe it, you can absorb some PFAS through your skin. Of course, drinking water is one of the primary routes of exposure simply because everyone has to drink water. Nationally, EPA estimates that the 2024 drinking water rule will reduce PFAS in the water of 100 million people. But people may also be exposed through eating food that was grown near facilities that make or use PFAS, potentially where pesticides made of PFAS have been used on fields, or by eating products impacted by sewage sludge-derived fertilizers contaminated with PFAS. People are also exposed through contact with products in their homes or at work. It's worth noting that of the PFAS that have been extensively studied, how toxic they are and how they harm people can vary a great deal. But we do know a lot about certain PFAS, like PFOA and PFOS, and we know that repeated exposure over time, even at extremely low levels, has been proven to significantly increase the risk of cancer, heart disease, infant mortality, low birth weight, and fetal developmental impacts, high blood pressure in pregnant women, and reduced effectiveness of vaccines in children. So can we do anything to destroy PFAS? Is there light at the end of this tunnel? Yes. There is an enormous amount of innovation and progress happening in this area. We have EPA methods to detect PFAS in water, air, and soil, and the cost of those tests have come down dramatically in recent years as the market has innovated and expanded. We've proven the effectiveness of commercially available technologies like reverse osmosis and activated carbon at removing PFAS from water. In 2024, EPA published guidance on destroying and disposing PFAS and plans to update it regularly. The guidance shows the effectiveness of many existing and novel approaches for tackling these chemicals. That's an area I'm happy to discuss further with anyone interested. Briefly, at the federal level, EPA and other agencies have taken a wide range of important steps and made real progress. You see things here like the drinking water and Superfund regulations and significant funding. We're seeing some signaling of rollbacks from EPA under the new administration, including part of the drinking water rule and reduced funding for Department of Defense cleanups. But we're also seeing them stand firm in other areas, like around the Superfund rule. So it's an interesting mixed bag. These chambers have also been busy working on this issue. The George Walter Taylor Act in 2022 directed MDE and other agencies to develop a state action plan, which we delivered in 2023. The last few years have seen bills to phase out some early categories of products that may contain intentionally added PFAS, including firefighting foam, and critically to begin addressing PFAS from industrial discharges. There was activity in the Assembly last year on PFAS and pesticides and biosolids, though both were withdrawn, and we know that there are several bills coming this year. I'm just going to briefly return to this slide to highlight how we are using our authorities, some state, some federal, now in Maryland to combat these chemicals. At the bottom, you see our general framework for addressing PFAS, which is to, 1, get upstream, prevent them from getting into the environment in the first place. 2, reduce high-risk exposures like drinking water, fish consumption, and contamination on farms. And 3, hold polluters accountable. Make sure the people who have contributed the most to these challenges stop and help pay for fixing them. You see a few color-coded boxes. Green is where we are really out in front, where we've made tremendous progress on things like drinking water, water quality monitoring, and providing actionable information to people who catch and eat fish in our waters, something obviously of critical importance to the state and the Bay economy. Yellow is where we have some strong authorities and are leveraging those to make real progress. These are areas where I am optimistic we will have data and other foundations to build on soon, though there is still much work to be done. And orange are those areas, things like biosolids, more product phase-outs, private wells, pretreatment programs, where additional stronger authorities and more tools would significantly accelerate our progress. I'll very briefly cover drinking water. This is an area where I'm proud to say Maryland really shines. In 2024, EPA promulgated national limits for 6 PFAS in drinking water from public water systems, PFOS, PFOA, and 4 others. Currently, EPA is planning to remove those 4 from the rule, which, while disappointing, we do not anticipate will impact Marylanders' drinking water. Over a period from 2024 to 2029, the rule requires monitoring, notifications to customers where PFAS levels exceed the federal limits, and requires that systems take steps to meet those limits by 2029, though the current EPA again may push that date back by 2 years. Even before the federal rules were finalized, MDE worked with public water systems across the state, which serve nearly 90% of households and businesses, to conduct early testing. This means that we knew early which water systems were likely to need to lower PFAS levels to comply with those federal rules. We know the 64 systems serving about 200,000 households that will need to bring those levels down. That early action has set us up to help nearly half of those systems secure more than $90 million to pay for upgrades to treat for PFAS, and we're working with the remaining systems to align needs with available funding. We're confident that we are on track to ensure that community water systems are in full compliance with the federal rules by the original 2029 deadline, regardless of EPA rollbacks. The George Walter Taylor Act set in motion some of the most significant actions we're taking today. That begins with ending the use of aqueous film-forming foam called AFFF for testing and training in Maryland. AFFF is one of the largest sources of one of the most dangerous PFAS, PFOS, And thanks to EPA and DoD collaboration to develop alternatives, there are now PFAS-free foams that fire departments, airports, and the military are transitioning to. The law establishes and at least partially funds a take-back program enabling MDE to support municipal fire departments in removing and safely destroying their unused stocks of foam concentrate. We've surveyed fire departments statewide and are aware of a total inventory of roughly 10,000 gallons of the concentrate ready for removal and destruction. We did run into a few procurement challenges along the way, but we are confident that we are on the cusp of reissuing an invitation for bids, and we'll have this program up and running very soon. Eliminating PFAS from our products and processes wherever feasible is one of the most important steps we can take to tackle PFAS. Keeping it out of contact with our food and water, out of our landfills and wastewater streams, and out of manufacturing to begin with is almost always the most effective and affordable way to reduce PFAS risk. Early efforts by this assembly focused on intentionally added PFAS in food packaging and rugs and carpets, and in 2024 added playground surface materials. We've made notifications to industry about these requirements and anticipate proposing regulations later this year to strengthen definitions, compliance, and enforcement. Zooming out, here's a chart showing the universe of states working on this and the types of products that they are tackling. It may not be possible to eliminate PFAS from all products because they are in some cases essential in certain medical devices, pharmaceuticals, computer chips, in space exploration. But there are many much more common products, things that come into contact with our bodies on a daily basis, which contain intentionally added PFAS. And for many of these products, there are PFAS-free alternatives, or the PFAS are simply non-essential to begin with. You see here that many states are addressing added PFAS in children's products like diapers, creams, toys, personal care products like dental floss, clothing, feminine hygiene products, and cookware. Some states have created tiered approaches with some phase-outs, some disclosures, and labeling requirements. Some are focused on specific categories, while others are pursuing an approach of everything unless it's exempted, which is also a strategy that the EU is considering. We're learning a lot from those states' experiences about some of the implementation challenges, and where to really focus efforts and resources to maximize protection and to minimize disruption to our lives and businesses. Let's talk for a moment about source trackdown. One of the priorities in our state action plan is to identify where PFAS is already out in the world impacting people. To do that, MDE is implementing a two-prong investigation framework. Where we already know there are PFAS in drinking and surface waters, we're working to identify the sources of that contamination so that we can contain it and ultimately mitigate it and hold the polluters accountable. And where we know or suspect that there is PFAS use or storage, we're also investigating if PFAS have been released into the environment so that we can, again, contain it and ultimately mitigate it and hold those polluters accountable. This past summer, MDE conducted a survey of PFAS levels at 120 surface water locations across the state to gauge ambient levels by watersheds and further support these trackdown efforts. And we're currently evaluating that data. Now let's talk about wastewater. I want to be very clear. Wastewater treatment plants are essential partners in protecting human health and are proud stewards of the environment. And that's why I've been proud to work on this issue over the last many months alongside MAMWA and representatives from the wastewater industry and the state. Like all of the waste that they handle, including human waste, treatment plants do not create the contaminants in their waste streams. But they do receive them, and they have to figure out how to either treat them or prevent them in the first place, whether it's E. coli, nutrients, lead or arsenic, and increasingly PFAS. MDE has sampled for PFAS at more than 100 treatment plants in the state, and 34 of them are developing source tracking plans. Implementing the 2024 Industrial User Bill, MDE this December published action levels for PFAS in the effluent of significant industrial users. Based on this first phase of investigations, that means that 7 industrial facilities around the state that currently discharge into plants like Back River, Patapsco, and WSSC will have to develop mitigation plans and bring those PFAS levels down. One of the things that I'm really excited about as we look to the future is several tools coming together. The 2024 legislation gave us an important start, helping us establish action levels and setting up the framework for a collaborative, not punitive, approach to reducing PFAS levels through source trackdowns and mitigation plans. The Federal Clean Water Act establishes what's called a pretreatment program, which gives strong delegated authorities and enforcement tools to most wastewater systems in Maryland or to MDE for smaller ones. This program allows treatment plants to say to dischargers, hey, we have to meet certain state and federal requirements, so you've got to clean up your act. Or, hey, restaurant, you can't just dump fat and grease down the drain and have it block the whole system. Or, hey, chemical facility, you can't throw explosives in the sewer. We use the pretreatment program every day to get at problematic substances in wastewater, but we largely haven't done it for PFAS yet. That is changing in some cases thanks to the 2024 legislation. But there's still a wide range of potential PFAS dischargers flagged to us by industry who aren't covered by that bill. And this is an area where additional standards and requirements would actually empower wastewater systems to compel a PFAS discharger to take corrective action. I just briefly want to share an example we have from looking at Michigan, whose Environment Department launched this program several years ago to trace PFAS back to those sources and use those pretreatment authorities. They found that in most systems, a limited number of dischargers were responsible for the majority of PFAS flowing into wastewater treatment plants. Local limits required them to treat at the source or find alternatives to PFAS. It shifted the burden and the cost of action from the wastewater treatment operator and the ratepayer to the entity using and discharging PFAS. Michigan has seen PFAS load reductions of as much as 99% using this strategy, and they did it without building massive, expensive PFAS destruction systems at the wastewater plants themselves. And that's the lesson. Effective source control works, and it's something that Maryland can replicate through collaboration and well-designed standards and regulations. Now, an issue I know that has gotten a lot of attention here in Maryland and in this assembly, and where we know a bill is coming this year. Wastewater treatment plants generate sludge, the thick or semi-solid byproduct of the treatment process. It won't stop. It's going to keep coming, and it has to go somewhere. That sludge is usually either landfilled or, better, treated to meet criteria established by EPA into a type of nutrient-rich fertilizer called biosolids. In many states and around the world, this is beneficially used on agricultural land, golf courses, and parks. And this management approach is good. This is the circular economy that we all want. It has greenhouse gas reduction benefits. It provides valuable low-cost products for farmers, and when done properly, it is safe. But remember, PFAS end up in our wastewater. They don't break down, they accumulate over time, and that includes on farm fields, so they present a real challenge to this program. EPA published a draft risk assessment in early 2025, which evaluated several theoretical but very possible realistic scenarios of PFOA and PFOS contamination in sludge and what happens when it gets used as fertilizer. The assessment found that over time, PFOS and PFOA contamination made its way into dairy products, eggs, meat, nearby drinking water wells, and streams and ponds used for fishing, and that the additive risk of cancer and other health effects exceed EPA's acceptable risk levels by several orders of magnitude. Depending on the specific assumptions you use, that's hundreds to thousands of more cases of cancer per million people. The Assembly's 2024 PFAS bill established mandatory testing for PFOA and PFOS in biosolids that are used as fertilizer. We also published voluntary guidance in 2024 recommending reduced rates of use where data showed higher levels of PFAS. But we need to do more to protect our drinking water sources, our land, our farms and farm workers, and all of us who consume products raised on those farms. We have nearly 500 samples now from big systems, little systems, rural systems, urban systems. It's a good data set. What I take away from it is that the vast majority of Maryland wastewater systems that land apply biosolids have comparatively low levels of PFAS. Would I like them to be lower? Sure, but they're not the lowest hanging fruit when we talk about reducing people's exposure. What we do see are a handful of plants, about half a dozen, that based on our 2025 data are near to or exceed the levels being discussed in legislation. That includes a couple of our largest systems, WSSC in Baltimore, and a few of our smaller systems. Now that's concerning, but this is a universe that we can wrap our arms around. This is a universe that, with the right authorities and tools, MDE can support in using those local limits to stop much of the PFAS before it gets into their systems. This is far more cost effective for everyone. It's far more efficient than trying to remove PFAS from the whole diluted volume of sewage when it gets to the plant, and it's fair. It puts the burden of reducing contamination on those that generate it, or it incentivizes alternatives that don't contain PFAS in the first place. And this is just the rest of that data set, which you'll have in the slides. All right, almost done here. So Maryland, through my department and the Attorney General, is actively working to hold the manufacturers of PFAS accountable for their contamination and to help pay for the costs of cleanup in the state. Currently, we're involved in 2 high-profile litigations with manufacturers. One is a statewide case against several chemical manufacturers, and one is a multi-district litigation specifically addressing contamination from the firefighting foam we discussed earlier. There's not much more that we can say on that right now, but can refer questions to the AG's office as people have them. Finally, I'll mention funding. Addressing PFAS does take resources. We were fortunate that the 2021 federal infrastructure bill included more than $10 billion nationally in grant funding dedicated to addressing PFAS, and Maryland has leveraged its allotment of those funds strategically. Those funds are administered in Maryland through MDE's Water Infrastructure Finance Administration and are eligible for a range of drinking water and wastewater treatment efforts. More than $115 million alone is going to PFAS drinking water treatment here in the state, and approximately $10 million has been committed to a wastewater pilot project. Unfortunately, this is the last year of that federal grant funding, but the state revolving loan funds we administer will continue to be a source of low-cost capital for water systems into the future. So wrapping this up, I'll share a few key takeaways. Maryland is among the leading states taking a balanced and evidence-based approach to PFAS action, and it's really that foundation of data and evidence that's driving our work forward. Second, I think it's important that we come to terms with the fact that it's unlikely that we will be able to eliminate PFAS in the environment and society entirely. The goal must be strategic reduction of exposure and risk. Third, PFAS can be prevented and removed and destroyed. They are not forever chemicals, but stopping PFAS at the source is generally the most effective and cost-effective long-term management strategy. As we seek to drive solutions, that requires collaboration across agencies, sectors, and jurisdictions, and that is exactly what my experience here at MDE over the last 366 days has been. Significant work is already underway to identify sources and clean up, but more federal and state authority is needed to support load reduction and to hold polluters accountable. And finally, PFOA and PFOS are where we are now. You hear those specific PFAS a lot, but they're not the end of the story. There are many more PFAS about which we are still learning that are used in other applications. And I feel like a lot of people start to feel like the goalpost on PFAS is always moving. Like, I thought we dealt with that, but now you're telling me there's another PFAS problem. Great. And it's just the nature of this complex problem, and it makes me think back to an early conversation that we had with Administrator Regan, who led the EPA in the Biden administration. And as we were talking about this, and he said, you know, as we do more, we'll learn more. And as we learn more, we will do more. And we liked that, and we put that in the EPA PFAS roadmap in 2021. And I do think that that is just the journey that we're on when it comes to PFAS. We know a lot, we're doing a lot, and that means we're learning more, and we'll have to do more. But I'm really glad for the collaboration with the folks in this room, with this assembly, with departments across the state, and excited about the progress that we're all making. Thank you.
Okay, thank you, Mr. Schaefer. Were you two guys here just for questions, or do you have anything further to add? Why don't you introduce yourself to the members of the committee, and what role you play within the Maryland Department of Environment?
Good afternoon, Lee Curry. Good afternoon, members of the committee, Mr. Chairman, Madam Chair. Lee Curry, I'm the Director of the Water and Science Administration at Maryland Department of the Environment. I oversee all the water regulatory programs, including some of the work that Mr. Schaefer highlighted here with respect to drinking water and the wastewater plants. So we're here for questions. Thank you.
Okay, Mr. Kessler, I'm outing your name because I know you
already know.
The Vice Chair, and I know you well. Yeah. Just for the rest of the committee, tell us.
Of course. Thank you, Mr. Chairman. I'm Vice Chair, members of the committee. I'm Rick Kessler. I am the Director of the Land and Materials Administration at MDE. And like Zach, just over a year, having arrived from EPA as well. So, and also here to answer questions.
Okay, we're going to take some questions. Let's start on this side with Senator Carrozza, then
Senator Brooks was before me.
Boy, that's really nice of you to do that, but okay, we'll go with Senator Brooks in that case, and then we'll go to Senator Carrozza, and then we'll go to Senator Hester. Okay, Senator Brooks.
Thanks, Jeff. Appreciate that. This is that. You know, the regulations in Maryland, I guess one would say probably paradoxical or either inconsistent. You know, we in the approach we look at. I'm looking at page 12 of your handout. And,
yeah.
I'm sorry, yeah. I'm looking at page 12 of the handout. And while Maryland has proactively banned, intentionally added PFAS in food packaging, rugs, and carpets, effective, like you say, January 1, 2024, Yeah, but it has not yet banned PFAS using active ingredients in pesticides that's used on foods. So I'm trying to see, there's a little paradox there.
Yeah, this is one of the really tough issues when it comes to PFAS. I know that there was a bill last year specifically to prohibit
Yes.
the use of
My bill.
Yes, yes. Yeah, I mean, candidly, that is an issue that keeps me up at night. It doesn't extend to the food packaging category is different from the pesticide category. Pesticides are regulated federally under FIFRA, which is a different set of federal regulations. But yeah, it is certainly a challenge. Now, the PFAS that are used in pesticides are not the same ones that we're talking about here today. We're talking about all PFAS today, but PFOA and PFOS are what we're talking about in the context of things like the biosolids monitoring that we're doing, the guidance we have, the legislation that's being discussed. There's, again, thousands of different kinds of PFAS. And the ones that are used in pesticides, my understanding is that most of them either are or break down into another type of PFAS called TFA, which does not bioaccumulate quite as much and has lower toxicity, but it still does build up in the environment to very high levels. And it has been banned in certain European countries, and the science is still evolving and maturing on it. And it is something that I think we need to study a lot more as studies evolve in the academic literature and from government research to really focus on. And happy to talk more about pesticides with you, if you like, along with my colleagues at MDA.
Okay. All right. Thanks.
Yeah.
Thanks, Chair.
Okay, let's go to Senator Carrozza again, then we'll go to Senator Hester.
Thank you, Mr. Chair, and thank you for this update. Was looking on your slides on the funding update and wanted to, I guess, better understand where we are. I'm aware that many local jurisdictions are concerned about the availability of expensive technology to eliminate PFAS in water and wastewater treatment. I saw on your slide, you said that I guess the federal funds came down, this $91 million, and then 25 million more in 2026. I was trying to better understand those funds and how it relates to Maryland.
Yeah, so in the Infrastructure Investment and Jobs Act, there were $10 billion set aside at EPA as part of the state revolving fund, but specifically dedicated to addressing emerging contaminants, most of which has been used to address PFAS. So that $10 billion was distributed by formula to states around the country. Maryland has received well over $100 million of those specific dedicated PFAS funds. I can get you the exact total numbers. But those are funds that we administer, like we administer the traditional SRF programs, but we've been proactively going to the water systems that we identified as having higher levels of PFAS and saying, we really want to work with you to find what's the right solution for you. In some cases, it may be just switching to an alternative water source. It may be merging with another unaffected system. In some cases, it may be installing treatment, which can be expensive. But so far, we believe that the availability of those funding resources roughly matches the demand for them. That 91 million we've already connected to about half of the wastewater systems that need to do something addresses, well, it's about half of the wastewater systems. It's about 90% of the total population of still impacted households. So we're getting the largest systems. We believe that there is sufficient funding left to get to those other systems. Lee, do you want to?
Just
One follow-up, Mr. Chair.
Go on.
You had mentioned wastewater. It's drinking water systems.
Excuse me?
These are the
I'm
drinking.
talking about drinking water systems
Okay.
to comply with the
Yes.
rules.
So you mentioned, I think in your answer, that you do provide some technical assistance, which, I represent 11 municipalities and some of them are small. So I would just want to be on record with you and have you on record that you'll continue to provide that technical assistance to those, especially those smaller municipalities that don't have the staff or resources?
Absolutely, absolutely. And do you have a status on where we are with that outreach?
Yeah, I will commit to do that. Our staff is reaching out to the smaller systems. Many of the systems that remain for funding are smaller systems, and we also work closely with the Maryland Rural Water Association to help them find solutions.
I'm glad to hear that.
Yes, you have my commitment that we'll continue to do that.
Thank you.
Okay, Senator Hester.
Thank you very much. I'd like to start the department. It was actually my bill in 2024 that started the trajectory of us looking upstream at the sources. And it was before you were here, but the staff that remains, many of them were very instrumental in helping us to get that right. So, and thank you all for your hard work, both in crafting the legislation, but also implementing it. I have 3 questions. The first one relates to that legislation. I thought I might have heard you say that the 2024 legislation was getting most of the big users, but not all of them. And some were falling through the cracks, and so I'd be interested in kind of what we need to change in that. That's my first question. My second question is, given the federal rollback of some of the 2024 drinking water standards, I thought I heard you say that Maryland wasn't going to change anything, or that we're still on track to meet the goals. So if you could just clarify that piece. And my final question was around private wells. I've had an ongoing conversation with Mr. Curry about the lack of any support on private wells. I know other states have started, funds to help with contamination, but what at this point are you recommending with response to, the parts of my district that are on private well and sewer? Thank you.
Yeah, that's a great question. So I'll start with the first one. So the 2024 legislation is an outstanding set of tools to help us set those action levels, which we set to help be protective of both sources of drinking water and accounting for the potential for PFAS being in biosolids. So that really has moved the needle forward on having numbers, having targets to reach to protect the environment and people's health. It also, it focused on significant industrial users, which are large dischargers, means like a larger volume of discharge. But there are contributors, there are dischargers and systems that may not contribute a very large volume, but may contribute a very concentrated volume. And so what we've heard, we surveyed, I think it was, we identified about 87 industrial and facilities that met the definition in the 2024 law, sampled there, that led to 7 that would exceed the action levels. But we know there are more than 7 facilities in the state that are discharging higher levels of PFAS into our waters. So this is like a bit of a belt and suspenders to get to the end goal, that we're coming down from the largest systems through the 2024 bill, but still need some tools to get at those, larger universe of small but still high impact dischargers in those systems. And then the other piece of it is, and what's most essential is to activate that pretreatment program and the local limits program so that a wastewater system can go to a discharger and say, we are requiring you to reduce these levels. There needs to be a regulatory hook, or there needs to be something that wastewater system would be held accountable for to pass that accountability using its local limits authorities up to the discharger. And so that's how, what some of the things being talked about this year try to sort of close the circle that the 2024 bill got almost all the way there on. I'm sorry, your second question was about the rollbacks to the drink. So the EPA rollbacks that have been, they haven't been started yet, but they've been announced, are to remove 4 of the 6 PFAS on which EPA set standards. So there's PFOS, PFOA, and 4 others, Gen X, PFHXS, PFNA, PFBS. Don't need to remember that. I lived and breathed this stuff for 4 years. So the EPA intends to remove those 4. That is, I am extremely disappointed by that, but the situation in Maryland is that the non-compliance at drinking water, we tested for all of those when we did that early monitoring, but the non-compliance would have been driven only by PFOS and PFOA, with one very small exception. There is one non-transient, non-community water system in the state that had higher levels of one of the other 4. But so out of 800 plus systems, only 1 would have been affected by those other 4, and we're still addressing that system regardless of what may happen with those standards. The other piece of the rollback is extending the compliance deadline by 2 years, from 2029 to 2031. There probably are a lot of systems and states around the country that do need that time. But in Maryland, because of the early start that Lee and his team and this department really took, we do believe that we are on track to have all of the regulated systems in compliance by 2029. Your third question was about private wells. This is a really, really challenging and tricky issue. The Federal Safe Drinking Water Act does not cover private wells. So a lot of the programs and the funding sources that we have, like the state revolving funds, are really not designed for or allowed to be used for private wells, except in certain limited cases where we are using them to, for instance, where there are contaminated wells near a regulated wastewater system, we can use those funds to bring that well, to connect that well to the system, or to study the implementation for creating a new system where if you want to get 25 or more people on private wells together to form a small water system. This is definitely an area that needs further attention. It may need some further authorities, and definitely funding that we don't have available to us at the department to help impacted households. That said, there are some cases in the state where we have investigations that have generated results that industry has impacted private wells, and there are places where through that process the responsible parties are providing treatment and filtration for residents. But yes, it's an area that does need further work.
Okay, any additional questions for this panel? Again, we have a second panel on this topic. Okay, well, thank you guys. Appreciate you coming in today. The second panel, we've got Dr. Priscilla Toe from WSSC. Doctor, here. Would you come on up? And then Matthew Garbark from the director, he's the director of the City of Baltimore's Department of Public Works. So those will be our two witnesses signed up for this panel, and then that'll be the PFAS briefings for today, and then we'll move to another subject area. Okay, who wants to take the lead here?
I'm going to kick things off and introduce folks, and then these two experts are going to take over. So good afternoon. My name is Lisa Oxenhurt, and I am here on behalf of the Maryland Association of Municipal Wastewater Agencies, or MAMWA. MAMWA is an association of county and municipally owned wastewater treatment plants and the leading environmental engineering firms that help those plants work for clean water across the state. Before we turn to the substantive comments on either side of me, I want to thank the committee very much for scheduling a briefing on a topic that is of critical importance to the state's wastewater plants. As WSSC Water will share, wastewater plants are already paying to conduct PFAS monitoring and identifying potential PFAS sources. Fortunately, they've been able to find partners to provide grants and other funding to support those efforts. In contrast, restricting or eliminating biosolids land application would cost 10 times as much, and local utilities would have no partners to bear those costs. They would be borne by our customers and your constituents. I'd also like to thank Senator Love, Delegate Stein, and MDE, especially for engaging with MAMWA and many of our individual members during the interim between last year and this year's sessions. We welcome the opportunity to participate in future discussions on how to best balance PFAS reductions with affordability concerns. MAMWA's goal in this is to ensure that we consider the financial feasibility of alternatives if there are restrictions on land application, give wastewater plants enough time to tackle this tough issue and challenge, and provide adequate financial resources to do so. As MDE just mentioned, we don't create PFAS at wastewater plants. Our customers and your constituents should not be asked to bear the full burden of solving the statewide issue. So I have many more people in the room than just next to me. You've already mentioned Dr. Priscilla Toe from WSSC Water and Matthew Garbark from the City of Baltimore. Also in attendance from WSSC is their General Manager, Keisha Powell's in the room, along with Laura O'Donnell and Monica Marquina. Mike Hallman.
Why don't folks who were just identified, why don't you stand up so we can see who you are, okay? Great.
Wonderful. Also in the room, Mike Hallman from the City of Baltimore. And from DC Water, Zach Borenpol is here. He's also in the audience. We have a few slides that have been prepared by WSSC Water, the city, and DC Water. Although we don't have DC Water at the table because of the time sort of constraints, we wanted you to have those slides in addition so that if you have constituents in their service area, you get those additional details. So with that introduction, I'm going to turn the mic over to Dr. Toe from WSSC Water to share some of the work that it's been doing to reduce the level of PFAS, both in effluents and in biosolids.
Good afternoon, members of the EEE Committee. My name is Dr. Priscilla Toe. I'm Director of Operational Reliability and Resilience at WSSC Water. We are a bi-county state agency and self-sustaining public utility serving Prince George's County and Montgomery counties. Thank you for the opportunity to share about how WSSC Water is proactively working to reduce PFAS. You should have received a handout. It's a 2-page, which contains much of the material that I'm going through on the slide, as well as some information for yourself or your constituents about PFAS and biosolids. As a water and wastewater utility, it is imperative, and we understand that, to understand the PFAS concentrations throughout our systems. We are proud to say that in 2025 alone, we have taken over 400 PFAS samples, spending over $300,000 to understand levels of PFAS in our water and wastewater systems. We have invested $1.5 million to set up an advanced PFAS lab so that we can better track down sources and serve as a regional resource. My objective today is to share how WSCC Water prioritizes public health protection by actively and proactively initiating projects to reduce PFAS, and how we prioritize affordability for our ratepayers by focusing on lowest cost, highest return PFAS reduction approaches. We collect 185 million gallons of wastewater per day from 1.9 residents across homes, industries, and businesses. As PFAS products continue to be used, as expected, we find PFAS in the community's wastewater, not at industrially impacted levels, but at typical urban, suburban, residential levels. PFAS, as with any contaminant, starts at the source and eventually ends up in places like wastewater and landfills and receiving water bodies. So a holistic PFAS reduction strategy starts at the source, as Maryland Department of Environment has set up a wonderful framework, and it takes time and resources to implement. So starting at the top of the slide, the most cost-effective PFAS reduction is stopping it at the source. The term source can be confusing. What I'm referring to is stopping PFAS in production and use, including manufacturing processes, industrial applications, and consumer products. For WSCC Water, stopping PFAS use effectively and permanently reduces PFAS in both treated wastewater and biosolids. No continuing operational costs required. It also puts the burden of PFAS reduction on producers instead of ratepayers. Now, as we move down the slide, next in line is reducing PFAS through pretreatment before it is discharged into our sewers. Pretreatment costs would fall on the industrial users who discharge PFAS into our systems, not on ratepayers. Once PFAS enters the wastewater collection system, then you need additional technology to recapture it, and so PFAS management costs spike up. WSCC Water has conducted extensive sampling across industrial and non-industrial discharges into our sewers. We have identified major PFAS inputs like local landfills and runoff from military bases. And now we are working closely with the Maryland Department of the Environment, and we appreciate their collaboration to identify what pretreatment approaches and authorities we have, as well as potential funding to practically implement mitigation. We know this approach works because strategic pretreatment has successfully reduced PFAS to low levels in wastewater and biosolids in states like the example cited earlier in Michigan. And stepping down again in the slide, in this multi-barrier strategy, we do continue to actively explore innovative technologies to treat the PFAS we receive at our water resource recovery facilities. We are currently leading and partnering in over $7 million of PFAS research projects, and nearly all of that is grant funded and not at a cost to our ratepayers. All of these technology tests are in the early R&D stages of evaluating scale-up feasibility. They are also end-of-pipe approaches that require more energy, more footprint, and significantly more unfunded costs than stopping PFAS sources or pretreatment. And as such, we have focused our research pilots on promising technologies that capture PFAS and treat, which enables a smaller treatment footprint while still retaining the agricultural and revenue value of biosolids, which is what WSCC Water had in mind when we invested $273 million in the Piscataway Bioenergy Facility commissioned last year that consolidates our biosolids management. We expect this to be more effective and less costly than high-temperature pyrolysis or incineration of biosolids. So in closing, if someone could go to slide 2 for me, what I've stepped through and what's summarized on the next slide. I don't know if someone can just forward that on that. Thank you, Lisa. What I've stepped through is WSCC's water approach, focusing on upstream source control and pretreatment to achieve the most cost-effective PFAS reductions, while still pursuing innovative treatment technologies to manage the PFAS we collect. So I thank you for your attention, and I remain available for any questions.
Okay, let's go to Matthew. Why don't you go last, and then we'll take some questions from the committee.
Thank you very much, Mr. Chair, Madam Vice Chair, members of the committee. I am Matt Garbark, the Director of Baltimore City's Department of Public Works. We are a city agency that runs a regional utility serving 1.8 million customers. All of Baltimore City is included in that, majority of Baltimore County, as well as portions of eastern Howard County and northern Anne Arundel County. What I want to do here is really frame what the costs would be if we were to focus at the end of the line, basically at the plants itself. I think a great perspective was given by Dr. Toe and others about the need for doing it before it gets to the plant and before it's at the end of that process. What I want to show is just how significant the costs would be if we had to do it at the plant. And I want to just be mindful to everyone that as a utility, and most utilities, every cost that we bear is directly borne by ratepayers. We don't get any funding from the city's general fund. We don't get any funding outside of our ratepayers. There are some limited grants, but as has been mentioned, a lot of those grant sources have stopped or are diminishing. So any costs that are borne by our utilities go directly to our ratepayers. The city of Baltimore would be hit particularly hard if financial impacts are not considered at the end of the line. And Baltimore City owns and operates two of the largest wastewater treatment plants in the state of Maryland, the Back River Wastewater Treatment Plant and the Patapsco Wastewater Treatment Plant. City estimates it would cost approximately $40 million annually to landfill our biosolids, assuming we could not use them for land application. I would also like to note here that there is little to no landfill capacity for biosolids in the state of Maryland, so we would need to be shipping these out of state, closest being Virginia. Virginia has indicated that they are anticipating to run out of landfill capacity within the next 2 years. So the costs of transporting these materials further and further out of the state increases the further we go. Installing treatment at both plants is even trickier, and it's more expensive. Unfortunately, there are a limited number of options right now out in the market to treat biosolids for these chemicals. The only mature technologies are incineration or pyrolysis or gasification. If the city could install pyrolysis or gasification technology, a big if, given the size of the plants, the city estimates it would cost around $650 million for the Back River wastewater treatment plant and $300 million for the Patapsco wastewater treatment plant. That's nearly $1 billion, including CapEx, operations and maintenance, as well as tipping fee costs. All of this would be costs that would be recuperated through our wastewater utility bills from the city's residents as well as businesses and those customers using the plant. That would be an extraordinary burden for our residents and those who are already struggling with increased costs. And I think it's something that we should bear in mind as we're looking at who pays, how it pays, and where we actually put the burden of regulating these chemicals and these materials. With that, thank you for the opportunity to speak, and I'd be happy to answer any questions.
Okay, thank you to the entire panel. We're going to take questions from members, and we're going to start with Vice Chair Kagan.
Thank you, Mr. Chair, and thank you all for what you do and for educating us to help us do our jobs better. It seems like I would be remiss with WSSC in the room, including our general manager, to not ask about the water main break. And I know that's off point, but you're in the room and this is a public hearing and I know the public wants an update. And I wonder if you could just give us very briefly, because we want to stay, we have a long day today, but if you wouldn't mind, thank you, Madam General Manager. If you would just introduce yourself and just give us a quick update, I know the committee would be grateful, especially the chair and me.
No worries.
Thank you.
Thank you, Madam Vice Chair. I'm Keisha Powell, I'm General Manager and CEO of WSSC Water. And Mr. Chair, distinguished members, thank you. By water main break, I am making the assumption that you're talking about the Potomac Interceptor. Yes. So that's a 78-inch sewage main that brings sewage from Virginia and down the coastline there to the Blue Plains wastewater treatment plant for treatment. We do have wastewater from our service area, some of the zip codes in the Montgomery County, and we can happy to provide a list to you of those communities that are contributing wastewater that flows into that particular pipeline. But we have not seen any backups as a result of this issue. The intake for our drinking water plant, it's important to note, is well upstream of it. We have a map that we can provide to show the location of our drinking water intake for the Potomac Water Treatment Plant in relation to that location. It's my understanding that DC Water was able to get the pumps situated to establish a bypass. And it was preliminarily communicated that their plan was to send the flows to the CNO Canal, which they were establishing as kind of a holding pit, if you will, to then pump around the break and get it back into the Potomac Interceptor to continue downstream to Blue Plains. I have limited information because my team is not handling it directly. But I do believe there's a press conference that has been scheduled for tomorrow by Washington Aqueduct. We will, and Priscilla's just been drafted to go, Dr. Toe, on our behalf to just make sure that communities are very clear that this is not an impact to drinking water. Though there are likely environmental impacts, obviously. There was raw sewage that was getting into the waterway. I do know that MDE has been engaged with them as well to provide information and support as they work through this incident, since the break is actually in our service area.
Thank you so much for that. Oh, my bad. Thank you. Thanks. Thank you for that update. Since it's only a few of us who are directly affected, or areas directly affected, I don't want to take more of the committee's time, but maybe if you could keep us updated. And I think what's relevant for us is also, how are these things avoided? How are pipeline breaks avoided in the future? Because a snowstorm, even a really big snowstorm, shouldn't end up with raw sewage in our waterways.
Yes, ma'am.
So, thank you.
If I could just use this as a plug to say how we avoid this is investing in that infrastructure. And I do know we pay a significant portion of the maintenance and repair for that pipeline because it is a joint use facility. And we are advocating for funding for repairs for our major pipelines, including the Anacostia Force Main and the Anacostia Gravity Sewer. Yesterday, the 28th, was the deadline for requests for WRDA, the Water Resources Development Act, which is federal. But we'll make sure that your offices also know what our advocacy priorities are for federal funding.
Thank you so much. Thank you for your leadership and for that information. Thank you, Mr. Chair.
Okay, let's take a couple more questions, and I think we need to move on to the next panels. Okay, but we're going to start with Senator Washington.
I do just have a question.
Manager, why don't you come back up?
Just one more. I just wanted to be clear. The sewage, you said something about it some of the services, not just Maryland. I don't know, did you say Virginia? I'd like to better understand where all the sewage is coming from that ended up in our
Sure. The
streams.
Potomac Interceptor actually starts as far as Dulles Airport and brings, there are multiple, it is an interceptor because it is picking up wastewater flows from multiple points along the route. So it comes out of Virginia and kind of doglegs down toward, comes across the river into Maryland, and it picks up sewage from our service area, and it carries that down to, it's one of the pipelines that is carrying wastewater down to the Blue Plains wastewater treatment plant in DC, which is managed by DC Water.
And I ask because, well, one, I care about water everywhere, but as a member of the Chesapeake, our Maryland delegation of the Chesapeake Bay Commission, so that there's a shared interjurisdictional interest in this. So would love to better understand how that works so that I can bring it up and maybe we can work through some suggestions as a region?
Absolutely, absolutely.
So, Mary Washington. in case
I
you
would
don't
be
know.
happy to meet with you, and we will certainly get your office information as well, or anyone who wants it, we can provide information.
Great, thank you, thank
Sure.
you. Thank you, Mr.
Thank you.
Okay, Senator Hester?
Thanks. I just have two quick questions and a potential follow-up. These questions are for WSSC and the City of Baltimore. I'm just curious if you could each comment on your current PFAS level in comparison to the MDE requirements and where your biosolids get applied, what type of land they're being applied to.
Great.
I'll start.
Right now, there are no regulated limits to PFAS and biosolids. So to your question is how do they
But you must
how do
know
they
the
compare?
level because MDE.
We know the levels. That's
What
right.
is the level, please?
We have average levels probably between about 30 to 40, 45 parts per billion in biosolids. These are shown on the chart that MDE displayed. And part of that is just reflecting the regional usage of PFAS and the sources that come to us. And part of that is because of the additional digestion and processing that we do of biosolids to make a cleaner and higher quality product. And then our solids, we contract the hauling of the solids to a contractor. And my understanding is that they bring that to, they have permits with many different land applications across the region.
So it could be farmland, it could be,
Yes.
there could be wells there.
It could be farmlands, but there are requirements on buffers or setbacks on where you could place the biosolids so that they have minimal impact to drinking water.
Okay, and do you have any support, like should a well become contaminated? Are you guys offering any support for that contamination?
I don't know how we would be able to support or know exactly where wells are being affected, but if we could look into exactly where our hauler takes the materials. The other thing that happens is when we contract out those services, they could be mixing the material with other sources that they bring in. So we are actually at WSSC Water, we're trying to understand a little better the impact of our biosolids, and we have started a research project specifically to understand when we apply our biosolids to a new piece of land, how does the PFAS move in the soil, and what does rainwater do? How does it bring it away? Because we are just as interested in understanding the impacts of PFAS. At the same time, we are doing everything we can to lower the levels so that, as shared earlier, PFAS is everywhere, but what we do know is that PFAS reduction is risk reduction. So whatever we can do to minimize is an improvement in public health. I'll add to that a lot of the issues that are related to contamination events, typically they are coming from industrially impacted biosolids. So where you have much higher PFAS loads and then those biosolids being applied to land.
I would just slightly disagree with that last statement. I believe there have been numerous farms, particularly in Maine, that have had to be shut down because of PFAS contamination from municipal wastewater sludge. So maybe not yet in Maryland, but we're trying to avoid that.
Yeah, so we'll continue monitoring and proactively monitoring because we also, monitoring is the first stage to management.
And it would be helpful to know where your contractors applied the things as well.
Yes, we can look that up.
Okay, any additional questions for this panel? Okay, sir, do you want to add?
Yes, Mr. Chair. Senator, I'm joined with Deputy Bureau Head Mike Hallman. He can speak about the levels at Baltimore City.
Yeah, so primarily we're running just over 26 micrograms per kilogram or parts per billion, if that's easier for folks to digest, so to speak. It is biosolids. I'm sure we don't want to talk about digestion. But yeah, so we're just over what could potentially be the in the tiering system that is being discussed, and we would be in a tier 2 level, which would restrict our availability for land, land application to 3 dry tons per acre. And that is where, as Director Garbark mentioned in his statement, our concerns come in terms of cost and for landfilling, because now we're going to require more sites than we currently do in order to be able to do that. I think that with an ongoing source tracking initiative, as was discussed by MDE, and potential mitigation plans, and a real timeline in order to have these facilities be able to meet those types of levels, we should see a decline in those particular levels, which would then put us well under the threshold.
Yeah, so, I mean, that was the whole reason I put in the bill in 2024, was to make the polluters pay and not you guys.
Yeah.
I think we all have to work together to make sure that our farmland and our drinking wells stay safe. Thank you very much.
Absolutely.
Okay, any additional questions? Seeing none, thank you for the presentation. We're going to now, Lamar, do we have to take a look? We have to take a couple minutes for a technical break here to. Are we off camera? Or no, we're on. Okay, well, in the meantime, while Lamoria is doing her technical adjustments, we can call up to the table. We've got 2 very distinguished folks that are going to introduce themselves.